House Bill 484 by Representative Cruz. 484 by Representative Cruz. It is enactment Title 40, relative regulation of abortion.
Senator Mizell.
Thank you, Mr. President, members. Members, the purpose of this bill is to allow a situation where the records at an abortion clinic are kept long enough for especially minors to have access to the records that signify there was a pregnancy that had taken place. I believe if you look at the bill, it also specifies in a more specific way that is the custodian of records at the abortion clinic is beyond one person, because what's been happening is that the owner and operator sometimes is out of state. The person actually on site doesn't realize that there is a legal responsibility to keep those records intact, and in the past they have not been keeping those records intact. So I see no questions and ask for favorable.
Do you have amendments, Mr. Secretary?
Yes, sir. I have amendments by Senator Morrell. Senator Morrell, it's set number 2260. 2260.
Senator Morrell.
Thank you, Mr. President. Members, what the amendment seeks to do, under current HIPAA law, when it comes to adults, they are required by federal law to keep the records for a period of 6 years. What this does, it removes the reference to the adults. It leaves all the language regarding minors and keeps the bill about keeping the records for minors. But considering that federal law already requires the holding of the patient records for adults, it's duplicative of federal law, and I don't think it's necessary. So that's what it does. But it preserves all the language in regards to minors, which is supposed to be the real purpose of the bill. So this amendment does.
Senator Milkovich, you got a question on the amendment?
Thank you, Mr. President and Senator Morrell. So this is does your amendment, part of the reason that we've wanted to track what's going on in the abortion clinics is there's a lot of instances, not only of human trafficking that goes under radar, but also a lot of post-procedure surgical complications. And I guess there's I think a compelling health interest for us to be able to keep track of abortion procedures where the women end up in the emergency room or have to be driven from the clinic to the. Does your amendment affect that at all?
It does not, because as I said, any interaction with anyone at a clinic under the Patient Privacy Act, HIPAA, the federal regulation, all records have to be kept for a period of 6 years. So that part with the adults is already captured in federal law. From my understanding, when I've looked at the debate on the issue, the concern has been records with minors, because obviously there's a human trafficking issue. Did the parent actually sign the waiver? Who brought them in? That is all still preserved in the bill as far as the interaction with minors. But as far as the medical records of adults, it's already covered under federal law. So all the amendment does is take out the portion with the adults, because it's already covered under federal law. It leaves all the stuff with minors intact. Because I've watched the debate on this, and the primary purpose of the debate has been the children issue. And with human trafficking, they bring children in to get abortions and all that stuff. It keeps that language in, because I think there's a compelling at least an argument can be made that there's a compelling state interest to deal with the minors and so forth. So that's what the amendment does.
Thank you, Mr. President. Thank you, Senator Morrell.
Senator Hewitt, you got a question?
Thank you, Mr. President. So, Senator, I'm also trying to understand the amendment. So the amendment is also taking out the language that was added in the bill that directs each physician who performs or induces an abortion, the medical director of the facility where the abortion was performed, the administrator of the facility, and each owner of the facility having an independent duty to keep the records. And so, to me, and I didn't listen to all the debate perhaps, but to me, that was also part of it, is that these had an independent duty to maintain records. And I'm not sure if taking all that out and your point about the federal law, if that kind of waters that down.
I don't think it does insofar as when it comes to the regulation of healthcare facilities, when it comes to mandating and checking records, when it comes to the penalties, the federal penalties far outweigh ours as far as not keeping adequate medical records. Because obviously, one of these procedures are all made for the most part due to some various fundings. For the most part, in my understanding, and I do healthcare law, HIPAA governs everything with privacy, and there can be an argument that some parts of this, if it isn't covered or conflicts with HIPAA, could render the entire statute invalid. Because as you know, when it comes to the regulation of healthcare, generally speaking, especially when you're keeping records in compliance with federal law, it governs over state law. So all that information should be kept pursuant to HIPAA anyway. So like I said, I was simply trying to put the bill in a posture that I think comports to what it says it wants to do. If the bill is about just keeping like a secret registry of people that are getting a medical procedure done, regardless of the fact a separate record keeping, separate from what is already federally required, then I think the bill should reflect that in the debate, which is that for abortion providers, for people providing abortions, any medical procedure at an abortion facility, we're going to keep a secret list that the state government could have to come right in and ask for this secret roll. If the documents are already being preserved, I think it's duplicative and not necessary.
Yeah, well, I don't read anything about secretive stuff, but I do wonder if HIPAA law is requiring all of these folks to keep records, because it wouldn't be intuitive to me that they would. I mean, I can see how the clinic perhaps has to keep records, but this bill is saying the physician has to keep records, the medical director of the facility, the administrator of the facility, and the owner of the facility have an independent duty to keep records. And I would be surprised if HIPAA would require all of those people to keep records. So I think we would be, with your amendment, changing the intent of the bill the way it was written.
Well, certainly it would require the doctor and the facility. If you're talking about whatever records the owner might have, if the owner is not a physician, I don't know what documents you'd be looking for him to have separate from what the facility and the doctor have. Is there instances in which the owner of a facility is, I mean, I guess the question is like, what documents would the owner of a building have that are not pertaining to a particular abortion that the doctor or the group providing the services would have?
Yeah, I mean, my read of it is that they would all be maintaining the same records virtually, but there was an intent by the author of the bill to maintain those records by all of those 4 or 5 different people, the same records. And it seems to me that if, and again, the author is not in the room, but it does seem to me that your amendment is changing the intent of the legislation the way it was written.
I think that is one possible way to look at it. I don't agree with it. I will tell you that in my experience doing healthcare law, that there's no documents pertaining to a medical procedure that would be kept in the ordinary course of business that isn't required to be kept by federal law. I mean, we've actually had to change laws here where we've had bills that we've passed that require the destruction of records, and we've had to come back and amend them because federal law requires you keep them for a fixed period of time. So I appreciate your perspective. I don't necessarily agree with it.
All right. Senator Mizell, you have any objection to the amendment?
Yes, members, I object to the amendment. What we're talking about is a lack of compliance. It doesn't matter what HIPAA has asked or what the Department of Health has asked. They have not complied. This bill allows for a longer time period, and it puts more layers of protection on who is supplying the information. It's not a secret registry. There's no secret registry. This is a situation where it's a patient and a medical practitioner performing a procedure. And I believe in 7 or 10 years from now, when a minor has been in or when an adult has been in and wants a record that she was brought in for an abortion, that information needs to be made available, and that's what this bill seeks to do.
All right, Senator Morrell, you can close on your amendment.
As I said previously, I think that if you're looking to get documentation as far as medical documents in regards to abortion procedures performed, that is covered under the Healthcare Portability Act, which is called HIPAA. Now, the issue becomes, and I talked about this briefly before, but when I talk about the owners, if you've got an owner of a building who is renting space to someone, and you now have them required to keep a separate set of books or records that normally you would not have to keep out of the course of business, because let's be honest, if an owner of a retail space is renting it to another person, to include him in here and to make it an environment where you expect him to go and to a business he's running to and to interact with their records, on one level, it's going to violate HIPAA, because an owner shouldn't be looking at personal records of any patients if he's not an owner, if he's not running the medical facility. And two, it's really just meant to discourage people from renting space to people, because now you've got them intimately involved in the operations of a facility, even if they're just renting space to it. So if we're going to get up here and say it's about health and safety, well, this amendment makes it about health and safety. If we're up here saying we're just trying to make yet another hurdle to space being able to be rented or obtained, because now the owner of a retail space has to somehow separately maintain health medical records, privacy records, that's completely different. It's really kind of a ridiculous government overreach that goes far beyond healthcare and providing people have. And as far as this argument of people aren't in compliance, you know what you haven't heard throughout this debate? They haven't cited one clinic. We don't have that many. I think we have 3 now. They haven't cited any one of the 3 clinics not keeping the records. So this is a solution in search of a problem. It is horrendous government overreach of private businesses. This amendment makes it about health care. If it's about shaming retail owners so that clinics can't find space, well, I mean, if that's your intent, I guess that's your intent. Thank you.
Senator Morrell has sent up an amendment to which there is objection. When the machines are open, those in favor will vote yes, those opposed no. Secretary, vote your machines, please. Vote your machines, please. Senator Long, no. You through voting? Senator Tauber, no. Senator Tauber, no. You through voting? All right, close them up, please. 9 yeas, 28 nays, and the amendment is rejected. You have further amendments? There was another here.
Have amendments by Senator Clater. Amendments by Senator Clater is set number 2864. 2864.
Senator Clater.
Thank you, Mr. President. What the amendment does on page 2, line 24, it changes the number 7 to 6. You heard JP talking about 6 is how long you have to retain it for HIPAA for adults. If the argument is that we're simply trying to make it as onerous as possible for somebody to have one of these procedures, by lowering the number to 6, I don't think we're making it any more onerous than the federal government already does. It doesn't change any of the other language. The language as it applies to children stays the same. So just simply overlaying it the same way that it is with HIPAA. I see no questions.
All right. Senator Mizell, you have an objection to the amendment?
I do object to the amendment. I'm carrying this bill for Representative Cruz, and I want it to leave here the way it got here. And I'd like it to stay at 7. I appreciate it.
All right.
He objected.
All right. Senator Clater, you have a right to close on your amendment. Anyways, Senator Clater has sent up an amendment to which there is objection. When the machines open, those in favor will vote yes, those opposed no. Open the machines, please. Vote your machines, please. Vote your machines. You through voting? Are you through voting? All right, close them up, please. 9 yeas, 28 nays. Amendment is rejected. Any further amendments, Mr. Secretary?
No
Any further
amendments.
discussion? Senator Mizell, you have a right to close on your bill.
Members, there is evidence. We carried a binder to the chamber for weeks, and we were Bagnerists, so we got tired of carrying the binder. I have a binder in my office of deficiencies this thick. These senators have shredded their records. This is not busy work that we're trying to find something to gotcha people. We have minors having abortions and young women that are being trafficked going in for abortions without records to verify what's taken place. So I appreciate the intent of the amendments, but Representative Cruz and I have committed ourselves to the wording as it got here, and I'd appreciate your favorable passage to send it back in that way. Thank you.
All right, ladies and gentlemen, move final passage on the bill. The machines open, those in favor, vote yes. Opposed, no. Vote your machines, please. Vote your machines. Yes. Senator Fanning, yes. Are you through voting? Senator Morris, yes. You through voting? I close them up, please. 32 yeas, 6 nays. The bill is finally passed. We consider vote, ladies and gentlemen, Dixon.